Hello, everyone. My name is Mimi. I'm the Student Services Counselor for the Community-Oriented Public Health Practice, also known as COPHP, Masters of Public Health program at the University of Washington in Seattle. Our program is one of a handful of MPH programs in the Department of Health Systems and Population Health here on campus. So thank you so much for your interest in our degree. The webinar will be roughly an hour or so and is aimed to introduce you to the mission and structure of COPHP and teach you how to apply for our degree. Know that you can always reach out to me if you have any questions or requests. We often open our classes up for prospective student observation, and I'm always excited to make connections to current or past COPHP students, teaching faculty, and program leaders. My email is right up here. Don't hesitate to contact me. I really love my job. So let's jump into it. Oh, and if you also hear any random puppy sounds, that is my puppy in the background. Okay, so COPHP is a very mission-aligned program. So I just want to start by reading the mission and goals to you. The mission of COPHP is to prepare students to become problem solvers, advocates, and leaders in community health. We do this by combining an active style of learning called problem-based learning. We pair that with rigorous academic preparation, a commitment to social justice and community engagement. We are a 2-year full-time in-person program that equips graduates with the knowledge and skills to effectively address public health challenges. Another important element I always like to touch on early in the webinar is the fact that COPHP's faculty, students, and curriculum have made a commitment to work towards becoming an anti-racist educational program. The UW School of Public Health and COPHP firmly believe that teaching public health through an anti-racist and anti-oppression lens is really the best way forward. This isn't to say that we get it perfectly right every time, but this commitment holds us all accountable to play a part in advancing towards true health equity. If you'd like to learn about specific examples of the work we've done as a program, department, and school to align ourselves with this commitment, please feel free to email me. So we're going to start off with a really common term in COPHP, learning objectives, which are COPHP's interpretation of the competencies that make our students true masters of public health. Like all MPH programs in our department, we're accredited by the Council for Public Health Education. And in order to be accredited, our curriculums need to fulfill a long list of competencies that ultimately make you a master of public health. Now, COPHP's primary focus is always on application, practice, and how public health is performed out in the real world. And so in order to ascend ourselves in action, we have taken this long list of competencies and massaged them into action statements and define those action statements as learning objectives. Then we thread these learning objectives throughout your entire 2 years with us. So your coursework, mentorship, research, and experiential training opportunities. This slide is all to say that we are an accredited MPH program, but COPHP wants to make sure that the work you're doing and the deliverables you produce during the program are not exclusively tied up in the theoretical space, rather a space of action and impact that academia doesn't always get to extend to their students. So these are some of the program's learning objectives that you can expect to master during your time in our program. I'll read off a few. After completing COPHP, you'll know how to assess community assets and needs. You'll know how to engage and mobilize communities around public health challenges. You'll know how to evaluate programs and policies. You'll know how to challenge the causes and effects of poverty and racism in our communities. You'll know how to develop, implement, and manage public health programs, and identify and address social structures and policies that create and perpetuate health disparities. I know I didn't read off every single learning objective on this list, but one thing you can really appreciate is that the first word in the behind every bullet is very much based in students actually doing things. They are identifying, they are intervening, they are communicating, they are challenging, they are evaluating, and they're being strategic in their influence. These learning objectives really keep COPHP and COPHP students rooted in action and allow for students to really have a runway for impact that other graduate programs really lock up in a theoretical space. We really want COPHP students to hit the ground running and make waves currently as students. So let's zoom out a bit and go into more specifics around the program overall. Keep in mind, COPHP cohorts are extremely small in comparison to other graduate programs, ranging from 17 or 18 to 27 students, which is our cohort cap. This is a cohort-based program, meaning you'll take all courses in a specific order with your specific cohort for the entire 2 years. The COPHP program provides master's level training to be an effective and responsible public health practitioner. We often get asked what a public health practitioner is, and it's also important to know that our alumni go off and work in all sectors of public health, not just practitioners. But I do want to tie back to the benefits of being trained as a practitioner. The way that I describe the role of a public health practitioner is someone who ethically approaches communities, flips the microphone around, and asks community members what is working for them and what is not serving them. Practitioners then use their power, privilege, and credentials to bolster what is working for these communities, to share power and embrace the wisdom and experience of that community. Public health practitioners also use those three important same things to dismantle programs and initiatives that aren't working for these communities. Practitioners are rooted in theory, but very much driven by action to improve community health. In order to start in our program, you'll need a bachelor's degree, and the program does recommend applicants who have, recommend that applicants have 2 years of work experience in public health by the time that they start in the program. The reason for this is due to our approach in problem-based learning, where students draw from academic, professional, and personal experiences to inform the collective knowledge in the classroom. Although it's recommended, COPHP does practice holistic admissions and understands unpaid and lived experience is greatly important to your understanding of public health. We consider unpaid work as being equivalent to paid work and have a question in our SOPHIS application asking if you'd like to provide any additional context to components of your application that may not clearly meet our recommendations. COPHP is unique in that it uses problem-based learning for our entire degree. We don't focus on lectures and assigned reading and textbooks. Rather, we focus on a case-based learning approach. Problem-based learning is an active learning environment, the opposite of a lecture or a didactic structured classroom. Our learning is self-directed, and although faculty are present in the classroom, the students really facilitate their own learning. If you're unfamiliar with problem-based learning, I encourage you to do some research on it to see if it complements your personal learning style. I also encourage you to search information on active learning and adult learning theory to understand the foundation of our pedagogical approaches. So diving into what problem-based learning is, and you'll see problem-based learning abbreviated as PBL. So what does problem-based learning look like for COPHP? We're one of a small handful of MPH programs in the country using this pedagogy to teach our content and also assess your understanding of the course material. As I mentioned, students take charge of their own learning, and the classroom setting is based on cases about real-world public issues. We don't exclusively use traditional methods such as lectures, tests, and textbooks to deliver our curriculum and assess your understanding of it. There are a few exceptions to the no lectures, tests, and textbooks rule, one being our analytic methods course that you take during your first year in COPHP, where you'll learn RStudio coding, a statistical software used for quantitative data analysis. Keep in mind, you're not required to have coding experience. We're really excited to teach you this skill, but this course does include a lecture element to assist students in learning coding effectively. And this is also the only COPHP course with a midterm and a final as well. We're also revamping our health policy course to meet students where they are and really focus on hard skills you can develop in graduate school to get you prepared for a career in this field. So instead of using these more traditional methods such as lectures, tests, and textbooks, COPHP breaks up our cohort into small teams of 7 to 10 people. We call those problem-based learning sections, and that team of people will work through cases describing specific public health issues, often written through the eyes of a public health practitioner. You'll work together in this team to analyze the case or the problem defined in the case. You'll also be asked to identify key learning points or objectives hidden within that case that are new to you, or maybe something that you think requires more research. And then we also ask students to explore solutions to the public health issues described in the case. Although your faculty instructor is very much in the room during problem-based learning, students are at the center of the class experience, and each case has a rotating student facilitator or pair of student facilitators that will guide their peers to the hidden learning objectives in the case. Problem-based learning in COPHP is student-centered and team-based, and are 2 hours and 50 minutes long, meet twice per week. So students grow immensely in their facilitation and discussion skills during the 2 years in the program. Every single case has multiple learning objectives weaved within it and hidden within it. And students work together as a group to identify key questions that need to be addressed, not only to understand the public health problem better, but to go a step further and explore potential solutions. At the end of each class period, every student walks away with a single learning objective prompt, which becomes their homework assignment for that class period. These objectives require students to dive into research and synthesize reports that would otherwise be chapters or sub-chapters in a textbook. We have students do this work so they flex their agency, consider multiple ways of knowing, observe data sovereignty, and teach their peers their findings to contribute to their understanding of complex public health competencies. An example of a learning objective question or prompt a problem-based learning team would synthesize in class to better understand a complex case would be describe effective practices for ethical data collection with communities, meaning this is something that your problem-based learning team is unfamiliar with, so it requires additional research. Another example of a learning objective would be describe the systematic barriers that one experiences accessing healthcare in the US, or for example, Seattle, Washington, and the systematic barriers in place just 3 hours away in Vancouver, Canada. By the time students graduate, they master over 250 learning objectives by way of processing over 50 cases. We'll get more into the details about problem-based learning, class flow, instructor in a few slides, but know these assignments and objectives require students to dive into research and really understand all the different components that go into really complex problems. Our students really get comfortable working in problems because they are omnipresent in public health, but our students are prepared by the time that they leave COPHP to hit the ground running and essentially work within the teams that they will be asked to in their career, similar to their problem-based learning sections, to really make an impact and make waves within their chosen career, whatever that sector of public health might look like. So zooming out further, stepping away from problem-based learning, but I promise we'll go back to it, know that COPHP is a generalist Master of Public Health program. This means that rather than focusing on a specific area or track of public health, such as global health or public health policy or social behavioral sciences, for example, COPHP students learn broadly about all the pillars of public health, such as epidemiology and biostatistics, health policy, environmental health, social behavioral sciences, evaluation management, and more. That said, some students do choose to focus in specialized areas by concentrating their electives in a specific topic or by completing a specific certificate, specialization, or concentration program in addition to the COPHP requirements. The most popular types of certificates our students choose are maternal and child health, disability studies, applied biostatistic, HIV, STIs, as well as qualitative methods. Many of these certificates do not come with an additional cost, but do require thoughtful course planning to meet both COPHP and certificate requirements. That keep in mind, though, some certificates, because there are hundreds out there, are self-sustaining, which means they can come with their own price tag on top of COPHP. I would only estimate that 1 or 2 students per cohort take on a certificate. It's by no means required for a degree, but is an option if you come in with a specific focus or a complementary focus or even a very different focus and want to complete a certificate there. As mentioned before, the focus in COPHP is always real-world practice. So instead of completing a thesis, which by nature often lives in theory, COPHP students complete both a practicum and a capstone project their first and second year, respectively. Both projects are individual, time-intensive, immersive experiences with community-based agencies or organizations. The end product of both of these projects will be a deliverable that addresses a specific public health question or problem the site has, and that deliverable is intended to go into their public programming if it is feasible for the site. We'll get into service learning and practicum and capstone in a few slides, but know that these projects are extremely impactful and ensure our students have multiple sources of real-world experience managing high-level projects by when they graduate, which can make them extremely competitive within the workforce. COPHP is an in-person program, meaning that we don't have online or hybrid classes, but some of your electives may have that format. There are other MPH programs in our department that are completely online. So if you have a situation where learning at a distance is what you need, please explore those, as COPHP isn't structured for virtual or high flex courses. Our program is 6 quarters. If you're new with the quarter system, that means our academic year usually starts at the end of September and wraps up the beginning or the middle of June. And keep in mind, there are no classes during summer quarter between first and second year in the program, but you do have option to take courses if you're interested. It's not required. However, you feel free to enjoy your time in Seattle, take on an internship, do study abroad, whatever your heart desires. It's also really important to note that our program is defined as full-time. I've never been able to support a student who is completing full-time work and that can also complete the program, but do keep in mind that many of our students do work part-time or less during their 2 years with us. Going back to full-time, we've been able to calculate and poll our students to determine how much time they spend specifically for COPHP coursework. It's also important to note that the UW Graduate School calculates that for every 1 credit graduate course, you can expect to complete 3 to 4 hours of work outside of class per week for that class's assignments. Because your problem-based learning courses in COPHP are 6 credits each, we can say, or we can estimate that you can expect to commit 18 to 24 hours outside of class per week, specifically for problem-based learning. Our first year students definitely fall on the higher end of that spectrum, between 20 and 24 hours, as they're still sharpening their research and writing skills, while second year students average closer to 18 to 20 hours per week outside of class for problem-based learning because they've really sharpened those skills. Reminder that courses are provided in a specific order and can't be taken out of order or outside of your cohort without prior approval. These bullet points here outline essentially what your transcript's going to look like when you're done with our degree. That includes 34 to 36 credits of core courses or problem-based learning courses spread across the 2 years. COPHP seminars are taken quarterly and result in 6 to 8 credits upon graduation. Students take 2 credits of practicum each quarter their first year, and 9 credits of capstone split across their entire second year. It's also important to note that we only require 6 credits of elective credits to graduate, but we don't gatekeep these electives. Meaning, if you want to take advantage of UW's impressive course catalog, we encourage you to do so. It doesn't matter if you find a graduate course in the School of Public Policy, Medicine, Education, Social Work, Communication, Business, as long as it's a 500 level course or above and the instructor hasn't put restrictions on the course, you belong there. Our students have very diverse expertises and interests, and we want you to grow spherically while you're here. You're free to specialize or diversify however much you want in COPHP. Here's your list of COPHP courses you'll take during your first year in the program. And this link up here goes to all of our course summaries. I really encourage you to look at that, these summaries, so you can understand more about the intentions of each course. Your problem-based learning course for autumn quarter is population health and community development. These are 2 very different courses within the span of a 10-week period. Every quarter, you'll also be taking a COPHP seminar where your entire cohort meets together once per week to learn from content experts about that week's case in problem-based learning, so you can understand how that person is working on that course or on that case content in their long-term job. This also helps our students network so they understand current sites, projects, and job titles working within cases that they're really passionate about. For winter quarter, your first year, you'll take for problem-based learning analytic methods or quantitative methods or epidemiology course. You'll learn RStudio coding. You'll interpret complex data sets. You'll generate reports, conclusions, and recommendations based off of that analysis. Keep in mind, again, you don't need to come in with coding experience. We're really excited to teach you this method. For spring quarter, problem-based learning is health behavior and promotion, as well as environmental health. Again, 2 courses in the span of 10-week period. Students get a lot of experience doing oral presentations and group projects this quarter to deepen their learning and practice different methods of reaching their audience. The first year's service learning experience for students is practicum, where students will work for a community-based agency or organization of their choosing to address a specific public health question or problem through an impactful deliverable, such as a needs assessment, curriculum design, evaluation, or even a peer-reviewed publication. Similar to an internship or an apprenticeship, practicum amounts to 160 hours of time spent at that site, working towards that deliverable, and that time is spent throughout winter and spring quarter during year 1. I find that it's helpful for some prospective students to see a visual schedule of COPHP's courses. Again, UW is on the quarter system, so the columns here on this infographic are our quarters. We have autumn, winter, and spring. Winter break takes place between autumn and winter, and spring break takes place during winter and spring. This big blue portion that you see on this slide is problem-based learning classes: population health, community development, quantitative methods, health behavior and promotion, as well as environmental health. And we have these 3 sections that meet for 2 hours and 50 minutes twice per week. These sections are mixed up every single quarter to ensure that by the time that you graduate from COPHP, you will have had a problem-based learning section with every student in your cohort. Keep in mind, first-year classes typically meet for problem-based learning on Tuesdays and Fridays, while most second-year problem-based learning courses meet on Mondays and Thursdays. The names listed here are our course instructors, or examples of our course instructors. For example, Haley, Kendra, and Barbara are our teaching team for population health. They collaborate to write cases intended to guide students to the competencies and learning objectives for that specific course. Every problem-based learning section, A, B, and C, processes the same case during the class period, but some differences include community-based agencies or organizations that you'll work with on culminating projects specific to your problem-based learning group, as well as instructors and obviously the students within each class section. Keep in mind, these project connections are facilitated by the faculty's expert network and often change year to year. This orange class here is seminar. As I mentioned, you'll meet as an entire cohort once per week to hear from visiting speakers who have expertise in the case you're working through in problem-based learning. These individuals help ground the case to current sites, projects, and job titles to deepen your understanding and increase your public health network. This class doesn't always have assignments, but often proves very valuable to connect students with potential sites, projects, and advisors for capstone and practicum projects and avenues for their next stages of their career. This final green class down here at the bottom is practicum, that culminating project for your first year in COPHP. Jasani Henry has been our practicum director forever. He was actually in the first graduating class of COPHP, and roughly a quarter of our instructors are alumni as well. With his position as our practicum director, he also works full-time for Public Health Seattle and King County, where Jasani spends his whole year shepherding current students through their practicum projects, but he also uses his amazing network to identify impactful and directive projects for incoming students, so that when you start your very first quarter in COPHP, he presents a list of many projects, often more projects than we have students. For example, this year we have 21 unselected projects, so we had many to choose from. During that autumn quarter, each site attends an autumn class period to actually introduce the project deliverable site supervisor and process for completing that practicum project. Jasani also meets with you individually during autumn quarter to learn your short and long-term goals for public health. And then at the end of autumn quarter, you rank your top projects and are placed in them so that when winter quarter does start, you start attending the site to work towards that deliverable instead of meeting together as a cohort for class. Keep in mind, you also have agency within the practicum experience as well. If you come into COPHP with a clear idea of a site you want to work with, a person working there that can supervise you, and a defined project process and deliverable, I'm happy to introduce you to Jasani during the summer before you start in COPHP to ensure the project meets the expectation of COPHP, is doable in 160 hours, on an academic timeline, and that you're supported on all sides with a well-scoped project. At the end of practicum, you'll hand off your deliverable at the site, give a presentation there and at UW, and you'll be a second year. I would say 1 to 2 students each cohort bring or create their own practicum project from their past connections. So it's a great opportunity to really build upon the experience that you already have while you're in the program to get you set up for success in your long-term career. So this is the, pardon me. So I want to note that COPHP's practicum process is quite different from larger or other MPH programs here at UW, where students are tasked with sourcing their own practicum project or designing it from the ground up. They are also largely calibrating to the MPH program, graduate school, and even potentially Seattle. We, as a program, highly curricularized practicum. So it's one of the many intentional elements of the program that really helps prepare our students to hit the ground running and execute high-level projects with transferable deliverables. And also helps with the competition energy that can happen while you are out trying to source your own project against all of your peers. Keep in mind, for both experiential learning projects for practicum and capstone, you'll have a faculty advisor to be a helpful point of contact on the UW side, as well as a site supervisor who will act as your day-to-day manager at the site to make sure your deliverable meets the agency's needs. Practicum and capstone projects are intended to help you build on these transferable skills, widen your public health network, influence public health programming, build relationships with community, and flex your strategic thinking skills to prepare you for that next stage of your career. Now let's talk about what a week in the life of COPHP student looks like, especially when it comes to problem-based learning. So in terms of the day-to-day rhythm, here's what to expect. As I mentioned, you meet twice a week for problem-based learning. For your first year, those days are on Tuesdays and Fridays. For Tuesday's class, you can see here in green, you'll get started with an icebreaker, first crafted by the rotating student facilitator or pairs of student facilitators. As briefly mentioned before, our instructors are present for the class meetings, but don't facilitate our problem-based learning courses themselves. Although each problem-based learning instructor is different, I frequently equate their role as to bumpers on a bowling alley. COPHP faculty provide a structure and safe environment for students to work as a team to complete their task for the class period, which is processing the case, identifying the learning objectives hidden within the case, and doing further research upon those. At the end of each class period, for problem-based learning, each student walks away with a single learning objective prompt or question to research and package into a report to teach your peers. Problem-based learning is a group learning space where your peers learn from you and you learn from them. These rotating student facilitators that will always start off with your icebreaker have met with the course instructor before that class period to discuss the hidden learning objectives hidden within the case and brainstorm facilitation ideas. All PBL classes start with an icebreaker, and then once everyone thaws out, that student facilitator will distribute a printout or an electronic copy of a case about a public health issue, most often written through the eyes of a public health practitioner. You'll first read the case aloud as a group, then you are all given time individually to read and process the case. During this individual time, you'll view the problem described in the case through the lens you've created from your experience in public health. Whether you pull from professional, personal, or academic experience, you will start to identify things that you know to be true about the case based off of your experience. And you'll start to list those truths in your notes to share with your peers later in the class period. As you start to process the case, you may identify things you know to be true. As you identify things you know to be true, you will also start to synthesize questions that need to be addressed to either help you better understand the problem described in the case or potentially explore solutions to the problem. This highlights the importance of having experience in public health when you start in the program. Our cohorts are diverse in their backgrounds, experiences, and passions, and we find that when all these brilliant minds get together in a room, they can think about problems from a solution-driven position and want to learn deeply from each other. So after you're done individually processing the case, you'll all come up for air and start to engage in discussion about the case. This is where all students in the problem-based learning section will share the things they know to be true, essentially building up the collective knowledge about the problem. As a team, you'll then pivot to identify 7 to 10 questions that you all agree would help deepen your understanding of the case and or lead to a potential solution to the problem. Everyone walks away with a single question or learning objective prompt that becomes your homework assignment for that day. These action items are those learning objectives we touched on at the beginning of the presentation. For example, describe effective practices for ethical data collection with communities. Or what are some systematic differences between accessing healthcare in Seattle versus 3 hours away in Vancouver, Canada? The most common type of assignment you'll do for COPHP to address your learning objective is a 5-page research paper. Once you've completed all your research and packaged it into a report, you'll upload that research paper onto Canvas, our online learning portal, the evening before your next class, seen in this image as Thursday, 6 p.m., but that time will be determined by your problem-based learning section and instructor. After you upload your paper to Canvas, you are required to read everyone in your problem-based learning section's reports. These assignments, again, essentially become the textbook for your problem-based learning section, and you are all the co-authors of it. COPHP students learn by consuming research in many forms for effective communications to teach their peers. The accountability to your peers in COPHP really can't be understated, as you're only given 2 to 3 days to produce the assignment, and you are effectively in charge with teaching your peers the course material. We know this pedagogy isn't for everyone, and that's okay, but if you learn by doing, thrive in teams, and want the opportunity to be at the center of your own educational experience, this program is absolutely for you. We also have your faculty instructor in the room prepared to clarify, reframe, redirect, and ensure that the class moves forward each class period. For your next class period, for example, here Friday, after the icebreaker, your section will undergo a debrief where you may split up into even smaller groups, or maybe do a big group discussion to discuss the learning objective reports submitted the evening prior. This debrief can be an open forum to resolve any remaining questions, allow for respectful feedback, or share any resources that proved helpful while you were researching. Once the debrief is done, your PBL section will move on to the next layer or day of the case. For example, here you can see on Tuesday, we went through case 1, day 1, on Friday, case 1, day 2. So we're essentially still working within the same problem, but a lot of the times our instructors will build our cases like upside down triangles, where they start off pretty broad, and then each layer or day into the case, you've really drilled down to the core issue causing the larger disparity. Other times our cases are more shallow and you'll move from a new case topic each class period. This is the weekly rhythm for every problem-based learning class. Case analysis, identify questions that need to be addressed, going off to do research that address those questions, teaching your peers, and then moving on to the next problem. Like I said, the most popular assignment for COPHP is a 5-page research paper where you'll condense your findings, analysis, critiques, synthesis, and reflections for your learning objective question. But one of the big goals of COPHP is teaching students the skills necessary to reach their specific audience. So in some classes, you'll learn different strategies to convey public health concepts, such as infographics, social media campaigns, policy briefs, lightning talks, community meetings, op-eds, and more. We want you to be able to do it all by the time that you leave COPHP. For example, I also recently learned about a COPHP alum who would package their learning objective homework findings as a graphic novel whenever there wasn't a format requirement. Again, we are student-centered and you are tasked with teaching your peers and deciding what best format would teach them those competencies. It's also important to note that some of our classes bake in group projects, where you will work with a community-based agency or organization on a deliverable that addresses a public health question or problem they have. For example, in year 1, your very first quarter in COPHP, you'll take community development, which will include an immersive site partner project, most often in a rural area of Washington State, where your problem-based learning section will actually travel to the site and complete a week of field work in community. This experience is fully funded by COPHP. There's no additional cost to students. And we also often open this course's final presentation as well as other immersive project final presentations for prospective student observations. So you can learn more about the work you'll complete while you're here in the program. But all of these projects change year to year, both topic, location, and site. So they're really exciting opportunities for our students to get in community early in their graduate career and ensure that when students leave, they have at minimum 4 massive projects of different sizes, scales, and speeds that really indicate their readiness for a long-term public health career of their choosing. These baked-in projects are designed for our students to experience rapid report settings and gain community level experience their very first quarter in graduate school. For your second year in COPHP, your autumn quarter problem-based learning class is Health Policy Development and Advocacy in the US, which sometimes involves site partnership for projects. This course also allows for students to engage with MPH students in the MPH specific policy track, another program within our department, which widens their network with other MPH students and allows for more collaboration. Winter quarter problem-based learning is participatory evaluation and community engagement. This course includes 10 weeks of designing and implementing an evaluation plan with a site partner. Every single year that I have attended these students' final presentations, the sites have been in attendance and have actually let the students know they've implemented up to 100% of their recommendations before the course even ended. This really is a great example of how students are able to impact current communities, individuals, and sites right now as students. They're able to influence change in their communities, sharpen their strategic thinking, and allow for deep learning with community. And again, this also adds to COPHP students leaving the program with at least 4 different external opportunities that they can build upon once they finish out the program. I realized I skipped over an important seminar class for autumn quarter. We recently created this course, a COPHP qualitative seminar. During your first year in COPHP, you take quantitative methods, and we've recently implemented a qualitative methods seminar as well. So our students leave COPHP with an understanding of both methods and often feel prepared to bring these skills into their service learning projects during the years as well. Pivoting back to problem-based learning, for spring quarter, problem-based learning is management and leadership. This final quarter in the program is really reflective and gets you ready for the next stage in your career by analyzing cases around managing and leading public health projects, teams, and organizations. You'll have multiple professional development workshops during this quarter as well to help springboard you into the next stage of your career. Just like year one, you'll always have that COPHP seminar where a lot of content experts come and ground the information that you're working through in problem-based learning. And the one time that this really changes during second year is your last quarter in COPHP. These weekly seminars convert to a couple 4-hour workshops where you'll meet with leaders in your specific fields of interest, do resume review, and other networking opportunities. The culminating project for year 2 in COPHP is Capstone, which is 9 credits total. It's a year-long project that you create from the ground up that amounts to 360 hours of work at a site of your choosing, working again on a deliverable that addresses a specific public health question, problem, or need. Students can specialize in an area by building off their practicum projects or diversify their connections and skills and work with a different organization, community, or method. Students build out their support teams for this project by choosing a faculty advisor and a site supervisor and do all of that necessary scoping that Jasani did for them during practicum. We also have an amazing capstone director, Jenya Shimkin, who is also an alum of the program and still runs her capstone project as a nonprofit to this day. Keep in mind, students will complete a contract, proposal, and literature review early in the capstone process and will have other checkpoints throughout the year to make sure that they're on track. At the end of these 360 hours, second-year students hand off their deliverable to their site, present their capstone projects at their site and UW, and go off to graduate to change their communities for the better. Keep in mind, some of our students perform study abroad for their capstone projects during the summer between year 1 and year 2, since you don't have to take required classes. And many are able to shape their deliverables to prepare them for their desired career. For example, a few years ago, we had a student produce 3 peer-reviewed articles as their deliverable for capstone because they really wanted a job doing public health research within academia down the road. As I mentioned before, there's an option to specialize within our generalist degree. You can do this a few different ways. First is by taking a certificate on top of our degree. There are so many certificates here at UW. And if you follow this link, you can check out the most popular ones and the full list. Keep in mind, a lot of them don't require additional costs, but they do require thoughtful course planning. They typically require 12 to 18 additional credits, but depending on the certificate you're considering, there might be the option to share credits with COPHP's curriculum. Again, reminder that some certificates might be self-sustaining and do require additional tuition or course fees. I'm always happy to help support students get across their finish lines when it comes to both graduate certificates and COPHP program. Alternatively, if you don't want to take on a certificate, you can concentrate your electives in one area of study. For example, this link takes you to a list of environmental health courses offered. There's also epidemiology courses and public policy courses, urban planning courses, social work courses, medical courses, all available to you. It is also important to it's also possible, to obtain a dual degree where you get your MPH and COPHP, and while you also get your Master's of Social Work or Master's of Urban Planning at the same time. If you're at all considering this dual degree path, I really encourage you to reach out to me so we can have an individual meeting. In that meeting, we will talk extensively about the 3-year degree commitment, the course plan outline, and the cost implications of being a dual degree student into different funding structures. It's important to note that we no longer accept clinical track MSW students due to new restrictive policies put in place by the graduate school that no longer allow for this combination of degrees to be completed in 3 years. But we do expect the other MSW tracks as well as Masters of Urban Planning. Applications to join the autumn 2026 entry cohort opened on September 1st and will close on January 15th. Decisions are typically conveyed in mid-February, right around Valentine's Day, and decisions are due from applicants by April 15th. You can always apply to multiple programs within our school, but keep in mind our application deadline could be different than other School of Public Health MPH programs. If you're unable to submit your application by January 15th, but still want to be considered for our next cohort, please do reach out to me directly via email. We may be able to review your application after the deadline's passed if there's still space in the cohort. So COPHP has 2 applications you must complete for entry. These 2 applications are separate. One is in SOPHIS, where we collect your transcript, essays, letters of recommendation, and more, while the UW Graduate School application essentially creates a shell for your student record if you are accepted. There's no essays or anything like that. And keep in mind, decisions related to your application, so admit, decline, or waitlist, will be issued through the UW Graduate School application, not in SOPHIS. These 2 platforms don't exchange any information with each other, so that's why it's required that you have both applications submitted so we can assess your readiness through SOPHIS and let you know about it through the UW Graduate School application, or let you know about the decision of your application through the UW Graduate School application. Thinking about admissions requirement, I've stated before that we require you to have a bachelor's degree from an accredited college or university in the US or its equivalent from an international institution. Additionally, students whose first language is not English must indicate English language proficiency before starting in our program. And there is information on the minimum graduate school admission requirements if you're interested to know more about those 2 bullet points, as well as the third. This third bullet point has a little bit of wiggle room. The graduate school prefers a minimum of a 3.0 GPA on a 4.0 scale. But again, we practice holistic admissions, and we have a question in our SOPHIS application where you can provide context to any elements of your application that may not clearly meet our preferences or recommendations. For example, if your car broke down on the way to your biostats final, like mine did, you can say, this grade isn't representative of my understanding of the material. I've done X, Y, and Z to increase my readiness. This question really helps us achieve holistic review so we don't reduce applicants to a 4.0 scale of readiness. Again, this last bullet point, we do encourage that applicants have roughly 2 years of post-college work experience by the time that they start in the program. But again, we count unpaid work experience as equivalent to paid, and we do accept applicants directly out of undergrad if they can demonstrate sufficient public health experience and or immersive work with communities during their time in undergrad. In COPHP, we firmly believe that everything is tied to public health. So even if you don't have a bachelor's in public health, if you can make a connection from your past experience to larger public health frameworks and goals, we love to see it. This consideration stems from our pedagogy of problem-based learning, where the class experience is largely informed by the existing knowledge in the room. And we want to make sure each student understands that they need to contribute as much as they extract within this really precious learning space. Again, we absolutely do not expect you to know it all. We are so excited to teach you and have you learn from a diverse group of amazing peers. Thinking about required application materials, our website really does a great job at outlining all the elements of both our applications, as well as workarounds and ways to save time. So going into the required application materials, again, both a SOFIS and UW graduate school application are required to be considered for our degree. You'll upload transcripts from every college or university where you earned a degree or completed relevant coursework in SOFIS. Note that we have a transcript bypass option outlined on our admissions website where you do not need to enter every course you've taken since high school manually, individually. But keep in mind this option is only available to applicants only applying to programs in our department, as transcripts and course lists are shared across all the programs you apply to in SOFIS. We don't want to sabotage your applications to other programs if they need that information. So definitely default to the most stringent material requests out of all the programs you're applying to. Also, keep in mind that if you choose this transcript bypass option, SOFIS customer service will contact you about your application being undeliverable. This is false. Please reach out to me directly if you have any questions about the completeness of your application. We have these options for many reasons, and they aren't always endorsed by the SOFIS team, but are absolutely enough to get you considered by our admissions team. Keep in mind also letters of recommendation are shared in SOFIS. This third bullet point, resume or CV will be uploaded in SOFIS. I always encourage applicants to be very inclusive, so you can include volunteering, internships, conferences, mentorships, overlapping school experience, anything you think that would increase our admissions committee's confidence that you're ready to jump into COPHP with both feet. Or whatever you have. This other bullet point for 3 letters of recommendation are going to be uploaded in SOFIS. Reminder that letters of recommendation are shared components. So if you can connect with your recommenders and say, don't mention a specific program unless you're only applying to that program, could be very helpful. We do require that one of your recommenders be an academic reference that can speak to your experience in a classroom setting. When we get 3 recommendations from employers, we know you're a great employee, but being a student is a different role and we need some context. If you've been out of school for a while and are concerned about getting an academic reference, email me and we can talk through exceptions. You'll also upload your essays into SOFIS. Lastly, we require TOEFL or EILTS scores or other methods to meet our English language proficiency requirement. GRE is not required, but you can provide these scores. They'll only help your readiness scores from our admissions committee. Again, review our admissions website, which outlines all the components of our applications, as well as these workarounds to save you time and money. Speaking of money, there are ways to apply to our program essentially free. There are 2 options for waiving the graduate school application fee. There are 2. The first one is the UW graduate school fee waiver policy. It's a little narrow. It includes PIPA and McNair fellows, but also importantly, financial need. Financial need does not require documentation, and you can request this waiver by checking a box directly in your UW graduate school application. The second waiver for the UW graduate school application states that if you've been associated with any of these organizations on the right side of the slide, plus others, our department will go and pay your UW application fee for you. Please note that if you want to request a waiver, you need to request it 5 to 7 days before submitting your application. We can't reimburse you after you have paid for it, so it needs to be unsubmitted for the department to go in and pay for you. You then will get an automatic email saying that you are ready to submit the application. SOFIS typically has application fee waivers available, but they usually run out on December 1st, which is before our deadline. And if you are approved for a waiver, you need to submit your application within 2 weeks of approval. There are 2 main things that our admissions committee looks for when reviewing your application material. One is we want to have you articulate how the program's unique attributes align with your learning style and career goals. COPHP is very different than most traditional graduate programs, and we need you to convey that you understand that aspect. The second part is We want you to demonstrate how your academic work and life experiences have prepared you to be successful in a demanding and rigorous graduate program. Again, we firmly believe that all work is related to public health in some way, but we want to see how your experiences have informed your public health passions and vice versa. Thinking about the cost of our program, it's important to note first that there are two different funding structures for graduate education at UW. One is tuition, where the amount you pay is dependent on your residency in Washington State. Washington State residents pay less tuition due to UW being a public institution, while out-of-state students pay roughly twice as much the cost for the same exact experience. That is tuition. COPHP is a fee-based program, which is the other funding structure. This means we have a flat rate for all students, regardless of where you come from. Our flat rate is this for this this is the current flat rate if you were to start with us this year, and this is the estimated total cost of the degree, again, if you were to start with us this year. Our flat rate is for all students, whether you are a Washington State resident, come from out of state, are international, or undocumented. The estimate, students in fee-based programs receive the same perks as students in tuition-based programs, such as a U-Pass that covers most public transit services across Seattle within your quarterly course fee costs. The public transit services that you get access to are buses, the light rail, which is like our subway system, and even some ferries too. I take a ferry onto campus and UW covers it. Our students are eligible for federal financial aid and the majority of internal and external funding awards, but our program does not accept Washington State financial aid, or WASFA. Another attractive approach our students have used to reduce the cost of their education is through student employment. UW has 3 different types of student assistantships: teaching, research, or administrative assistantships. You can be employed in any school or department of UW. These positions come in all types of capacities, from 1 hour a week to 20 hours a week. But keep in mind, the 20-hour-a-week positions specifically come with some amazing perks. One is hourly or salary pay, depending on how the position is written. 2, benefits, including mental, dental, vision, and pharmacy. 3rd is a course fee waiver, where your hiring unit will cover 90 to 95% of your quarterly course fees during the quarters you are employed. Gentle reminder that COPHP is a full-time program, and we do not place you into these positions, and they are extremely competitive. That said, COPHP students do have the highest percentage of assistantships across all MPH programs in our department, and I kind of interpret this metric 2 ways. Obviously, the need is great. Otherwise, students wouldn't be taking on these heavy 20-hour-a-week appointments. But additionally, I firmly believe that because COPHP intentionally creates opportunities for students to deepen their research, teaching, facilitation, and project management skills within every single one of their classes, our students can become really competitive for many of these positions in teaching, research, and administrative positions. Our cost and aid website updates every single year with the future cohorts cost in middle of spring, usually close to April or May. So thinking about our amazing alumni, our communications team recently updated our alumni report to capture what our alumni are doing post-pandemic, and here are some general statistics about them. 90% of our alumni are working full-time, and 99% work in public health. We have alumni representation across 19 states, 6 countries, and 35% of our alumni work outside of Washington State. So you aren't pigeonholed to stay in the Pacific Northwest. All the skills that we teach you are intended to be transferable to any position, any location that you want to go into. Across the various public health sectors, our alumni are represented across academic institutions, nonprofit, local government, healthcare, for-profit, state, federal, and self-employed positions. You can read more information about specific alumni in the link down here, but know that our degree prepares students to go and work in many sectors of public health. And I'm always happy to connect you with some alumni so you can learn from their perspectives and how our program specifically prepared them for their long-term career. So wrapping up, out of all the potential degree experiences you could have for your MPH, here are some of the reasons why you may want to choose COPHP. One is we are one of maybe 2 or 3 MPH programs in the country using problem-based learning to deliver a Master's of Public Health degree. This pedagogy is vastly different from traditional learning environments and comes with high accountability, but we've intentionally built our degree so students become very comfortable working through problems in teams that ultimately model the types of working groups you'll have in your long-term profession. Problems are omnipresent in public health, and our students are prepared to address them without being tethered to a textbook or lecture notes. They've worked in and with problems for 2 years, if not more, and have been trained to see themselves as key parts to the solutions for these problems. Second, our faculty are amazing. Many of our faculty are not full-time professors, rather public health leaders across many organizations at various local, state, and federal levels who have a deep understanding of current issues impacting communities right now. I mentioned Jasani as an example earlier in the presentation, but many of our faculty have full-time positions external to UW. They bring all their wisdom, connections, and perspectives of the current public health problems communities are facing into the classrooms for the course that they teach. This sometimes makes it hard to get in touch with them when they're not actively teaching because they're out actively changing the world. But if we find the pros far outweigh the cons on this point, and we are still able to maintain strong mentorship agreements for both of your years in the degree. In first year in your program, you're assigned a faculty advisor, and in second year, you get to choose your faculty advisor to oversee your capstone project. We are ranked among the top 10 public health graduate schools. Last year, UW was ranked number 5 in the country. Lastly, UW has been named the most innovative public university in the world. I always hesitate amplifying sensationalized reviews, but something I can say with complete confidence is it's really nice being in a small program in a big school. You're given all the community and support of something small, but all of the resources and impact of a giant institution. So it really can be the best of both worlds. Seattle. Seattle is the largest city in the Pacific Northwest and is a great place to do public health work. Please reach out to us if you're in the area. We'd love to invite you into our classrooms, meet with our current students, faculty, and learn more about what your life would look like here as a student. We also often are able to provide small travel stipends to accepted applicants during the decision period between February and April 15th. So if invited, please do apply for those funds early because they run out very fast. Keep in mind, Seattle is not a perfect place by any means. It is a quite expensive place to live. However, there is so much energy and excitement around addressing public health challenges in the Pacific Northwest, and it's a really collaborative and positive experience to immerse yourself in this region to work on big projects and problems as a graduate student. So thinking about next steps, you can always email me up here to again, I'm the lady from application to graduation, and I really love my job. Feel free to email me if you want to be connected with a current student, faculty member, alumni, or in a specific job or something like that. Set up that individual meeting with me if you're considering a dual degree with MSW or MUP, as this process is very involved. In that one-on-one meeting, we'll discuss the 3-year course plan and how to make the most of it. I'll also help you calculate the estimate cost for completing both degrees based off on your individual situation, since MSW and Masters of Urban Planning are both tuition-based degrees, and COPHP, again, is the fee-based degree. And then lastly, if you're interested in starting COPHP next fall, sign up for our admissions newsletter and start your SOFIS and UW graduate school applications so you can get them in by January 15th. Again, here's the contact information. Thank you for your time and energy. I hope you have a great rest of your day.